Fatty fish like salmon provide two critical immune-supporting nutrients, omega-3 fatty acids EPA and DHA with anti-inflammatory effects, and vitamin D essential for immune regulation. The anti-inflammatory effects of omega-3s are well established. They reduce excessive inflammation, allowing appropriate immune response without inflammatory tissue damage. Vitamin D regulating immune cell activity and being essential for antimicrobial peptide production is fundamental immunology. The connection between vitamin D deficiency and increased respiratory infection risk is strongly supported by research. Winter's higher infection rates correlate with reduced vitamin D synthesis from limited sun exposure, making dietary vitamin D particularly important during cold and flu season. One 3-ounce salmon serving providing 526 IU vitamin D, 131% of the daily value for sockeye, is substantial. However, we should note that vitamin D recommendations have evolved, with many experts suggesting higher intakes than the official daily values, particularly for immune support and during winter. The recommendation to consume fatty fish 2 to 3 times weekly year-round, more during winter, is practical and aligns with general dietary guidelines. Baking salmon with lemon and herbs, grilling with olive oil and garlic, adding canned salmon with bones to salads, or making salmon soup are all achievable preparations. The note that wild-caught salmon typically has higher omega-3 and vitamin D content than farmed is accurate, though farmed salmon still provides substantial amounts and is often more affordable and accessible. The mention of alternative fatty fish, sardines, mackerel, herring, is helpful since salmon can be expensive. For people who don't eat fish, the acknowledgement that algae-based omega-3 supplements and vitamin D3 supplements can provide these nutrients is important. This is particularly relevant for vegetarians, vegans, and people who dislike fish or have allergies. However, some critical considerations. Mercury contamination in fish is a legitimate concern, though salmon is generally lower in mercury than larger predatory fish like tuna or swordfish. Pregnant women and young children should still be mindful of fish consumption recommendations. The combination of omega-3s and vitamin D being particularly valuable during cold and flu season is emphasized, and this makes biological sense given both nutrients' roles in immune function. The suggestion to pair with leafy greens for comprehensive immune nutrition creates balanced meals. Omega-3 supplements from fish oil are popular, but whole fish provides a broader nutrient matrix including protein, B vitamins, selenium, and other compounds that isolated supplements lack. The synergistic effects of nutrients in whole foods often exceed isolated supplementation. The anti-inflammatory effects of omega-3s are dose-dependent, and achieving therapeutic levels may require either regular fatty fish consumption or supplementation. The amounts from occasional fish consumption provide baseline support, but may not be sufficient for significant anti-inflammatory effects. Vitamin D synthesis from sun exposure is complex, varying by latitude, season, time of day, skin pigmentation, and sunscreen use. For many people, dietary vitamin D and supplementation are necessary to maintain adequate levels, particularly during winter months. Overall, salmon and other fatty fish provide concentrated sources of two critical immune-supporting nutrients that are challenging to obtain adequately from other foods, making them genuinely valuable for disease prevention.